they need to later they need to key in all the information of the suspected dengue cases in our we call it e-dengue e-notification system. Before they key in the information, they have to make sure that the case is confirmatory to dengue through either NS1, IgM, IgG. This is the policy that we used since 2014. Okay. Once case is verified by the receiving district, the case will then be transferred to another system. We call it e-dengue system. Basically, e-notification system and e-dengue system are related, but they are actually two different systems. The case investigation will be subsequently carried out within 24 hours, after which dengue control will take place. As you all know, vector-borne diseases such as dengue cause deaths and mobility. It is also an obstacle to social and economic development, which lead to loss of working hours and high cost of treating disease. The second SOP is related to dengue control. There is a source reduction of Aedes larvae population. It is also must be carried out in 24 hours after case notified into a dengue system. The Aedes inspection and source reduction must cover 100% of the total premises in that locality within 3 days. So meaning to say they have to finish the Aedes inspection in 3 days. So you must cover 100% of the premise in that locality. So the area coverage is 200 meters for single case and 400 meters in case of outbreak. And it covers indoor and outdoor source reduction. The third SOP is space spray of adult Aedes population. Just like source reduction, space spray must be stepped up within 24 hours after case notified into our e-dengue system. Premise coverage in the area must be at least 80%. So just now for soil reduction, we have to cover 100%, but for space spray, we have to make sure that we cover at least 80% of the total premises. We don't expect 100% here, since it is impossible to complete the space spray in a day. So you cannot resume the work the next day, okay? Because it is different from source reduction. So the area coverage is still 200 meters for single case and 400 meters in outbreak situation. So in order to have a maximum impact, thermal fogging must be complemented with VLV in outbreak situation to increase high acceptance of to increase high acceptance by the premise owner. Indoor fogging will be using water-based insecticide, or else they may refuse entry for indoor fogging. The fourth SOP is larviciding. So for larviciding, all spots that are potentially harbor any breeding will be larvicided, especially in the back lane, empty lots where breeding is commonly found. So in that case, normally we use either thermopause or BTI. Okay, the fourth SOP is outdoor residual spray. Even though residual spray has been practiced long time ago as a method, it is basically a novel approach in Malaysia, and it first started in 2015. As far as ORS is concerned, we are very selective in this manner. Okay, only the hotspot locality with outbreak situation, with outbreak duration of more than 30 days will be selected and sprayed. Since the suitable insecticide in the market is limited for the WALS, and based on our last experience doing this method, we believe that the insecticide can only last for 3 months for dengue control, since we spray mainly outdoor and indoor, unlike for malaria control, we spray indoor, right? So the sixth SOP is the release of adult Wolbachia mosquito. It is also considered a new tool in dengue control in Malaysia, which was first introduced in 2019 as a part of operational method. We are taking up a replacement method for the mosquito release, whereby we release both male and female Aedes aegypti in the wild. So up to now, we have around 30 localities nationwide, which embark on this Wolbachia project. So we believe that after 15 weeks of first release, 60% of the Aedes wild population had been replaced by Aedes carrying Wolbachia. So it is possible, even though difficult. That is what we had experienced so far. Okay, now here's the, I would like to share with you the current situation, the current dengue situation in Malaysia as of EPID week 4 this year. Okay, as you see on the screen, we have seen an increase by 204% compared to the same period of last year. So this year we already have almost 9,000 cases compared to 3,000 cases last year. As for mortality, there are 400% increase this year. Last year we have none dengue deaths. So the increase is big, quite big. Okay. From the table, we can see that from 2010 and 2022, Malaysia had a fluctuating trend of dengue cases. We can see the trend, right? Okay. And I think our neighboring countries also experience the same pattern. Okay, as you can see in the table, our highest number of dengue cases ever recorded was before COVID-19 pandemic. Okay, that was in 2019, and with over 130,000 cases. The second was in 2015 with over 120 cases. Okay, now we come to the summary of dengue epidemiology in 2022, which is last year. Okay, I will give you a brief summary on that. About 55% of cases was sporadic. Altogether, there were almost 8,000 outbreak localities, with some having occurrence of outbreak of more than one episode. And 85% of the cases were among mobile group, which include school-going children and working adults. So one can make a hypothesis as to where they got the infection from. So there is probably outdoor transmission away from home. Okay, so how did we perform in dengue control? As for single case, we only managed to cover 60% of the total cases, especially in Klang Valley area. The complete inspection was around 40%. Complete means you managed to inspect outdoor and indoor, with only 35% of targeted premises for indoor. As for outbreak, we perform better in this manner, with 75% of the total cases covered. The complete Aedes inspection was much lower, just around 30%, with only 32% of targeted premises for indoor. So we find it difficult, to do dengue control as far as space spraying is concerned. Okay. What are the challenges? Now we come to the what are the challenges of dengue control that we are facing? Okay, for control measures such as premise inspection, space spray, larviciding, targeted outdoor rescue spray, refuse entry and obstruction of duty are among the challenges. How do we overcome this? Okay, we have a law and an act, we call it Destruction of Disease-Bearing Insect since 1975. Okay, so we have to be strict with our law here. So we use section 5(5) and section 21, and we even take some of them to court. Okay, upon conviction, they can be fined not exceeding 100,000 ringgit or to imprisonment for a term of not exceeding 2 years or both. Okay, the third one is refusal to give information required by the investigating officer is also punishable under section 7(1) of the Act. Okay, then vacant house is also a challenge in Malaysia. So we have to seek cooperation from the local authority or joint board management or JMB to help us identify the owner of the premise for our further action. So the other one is we also encounter problem when the owner of the units let their dog loose free. So some of dogs are a bit aggressive. Okay, a bit aggressive. It can pose a threat to our staff. Okay, and rainy season is also a problem. During a year, there are an average of 240 rainy days, especially in the late afternoon, which make it difficult. Okay, make it difficult, to do space spray. So we need to reschedule the timetable, okay, to the next day, which may result in many more cases left unattended. Okay, we cannot cover all cases in that case, in that manner. Okay, the next is especially in the high burden state, especially in Klang Valley, that's in Kuala Lumpur, only 20 to 30% of reported cases are covered, okay, due to lack of resources. So to overcome this, we employ pest control operators, to help us do space spray or source reduction. Okay, low premise coverage and below par performance are the other problems that we are facing. So to overcome this, close supervision need to be in place regularly, and at the same time we need to do something, to build up the staff confidence and self-confidence by organizing some series of motivational training. Okay. Next is the challenges is house closed during office hours. For premise inspection, just like I mentioned earlier, the coverage was around 30%. Normally we do the inspection during office hours, but our law, under our law, section 5(5) permits it permits us to conduct the inspection after 6 to 10 p.m. So meaning to say, after office hours, when the owner of the house already returned home from work, we can go to the house and do the inspection from 6 p.m. to 10 p.m. Okay. Next is the no Aedes breeding found. Sometimes breeding is not found even though the source of infection is believed to be locally transmitted. In certain districts, 70% of the activity carried out was zero breeding. So again, close supervision is needed in this case. Plus, check the quality of the control activities. Okay. As for thermal spray, among the challenges are we find that through our monitoring, the dosage of insecticide is insufficient. and there is a possibility of resistance being developed in the in Aedes population. So rotation of insecticide is one of the options that we used to do beside close supervision. We also face problem in the same challenges in ULV space spray, just like in thermal space spray. So more or less the same measures are being taken up. This is close supervision and rotation of the insecticide. Okay, as for ORS and the release of Wolbachia infected Aedes, lack of training and dedicated staff, as well as financial support, are the things that limit the extension of the method to other localities. So we need to say we cannot expand the locality to many more areas, as they are quite new in Malaysia. So we need to convince the government to give more money or more budget, for us to expand this method to the other state. Okay, but in some states we also employ PCOs or pest control operators to do ORS, or maybe in the future probably we can outsource the Wolbachia project. Okay, the other problem is the abundance of Aedes aegypti in the Wolbachia release area. So the abundance of Aedes aegypti around the release area will affect the sustainability of the Wolbachia infected Aedes aegypti. So need to do source reduction as well as regular BTI larviciding. So now we come to the conclusion as suggested by the WHO. For dengue vector control. Existing vector control approaches has failed to curb dengue transmission, but continue to be used despite absent evidence of their effectiveness. So the present and conventional methods are less successful. I can say that less successful in managing the dengue transmission. So there is a need to review the current strategy of dengue control. Okay. Next, effort for vector control must be based on transdisciplinary of the IVM element. So in a single control intervention approach may not have any substantial impact. So for future direction on dengue control should focus on integrated tools such as Wolbachia infected Aedes aegypti program. Another for the way forward. Okay, number one, we have to make sure that IVM is already in place. So vector control does not rely on a single intervention. So we need to do more. So whenever possible, environmental, biological, and chemical must complement each other in what is known as IVM. The optimal use of resources for vector control to improve efficacy and effectiveness, ecological soundness, and sustained vector control program. We have a systematic review conducted by Health Transmission Technology Assessment team in 2019 shows that IVM could substantially reduce the cost of dengue control. In this review, it was found that over 3 years, from 2016 to 2018, the total cost, we can save total cost saving from reduction of dengue case, 101 million by 13.08%. So if you do IVM, we can save some money by embarking on this IVM. Okay, the way forward, the second one is biological control method, Wolbachia infected Aedes. Wolbachia is probably the control method that we could expand to all states in Malaysia. Okay, and then community mobilization and empowerment. Community need to be mobilized to do self-inspection. and source reduction in their surrounding. As of now, we have around, sorry, there's typing error there. We have around 3,257 combi project nationwide and involving 30,342 volunteers. So the last one, we also in cooperation of artificial intelligence concept, to predict outbreak, so in this case, we we have a good collaboration with Malaysian Space Agency for a correct or more precise prediction of dengue occurrence. So with that, I thank for your kind attention.